welcome to this video with me, Tanya Ross of TR Academy of Movement and Therapy. This video is going to take you through an active test that you can do yourself related to an upper limb tension test for the median nerve. And this will typically affect you in the sense that if you're getting any symptoms with it, it could be around the neck area and it could be down the upper arm, it could be down into the forearm and down into the fingers. In particular, the thumb, the index finger and the longest finger. So if you're getting any nervy symptoms, for example, pins and needles, zinging, tingling, numbness, anything like that coming down, it might be nerves. That's where it's always good to see a therapist to get a diagnosis. So it's an educated opinion about what it is. But maybe if you stick to these movements and try them very safely and progressively, they may actually be able to give you some self-help measures. So this first test, the movement is just taking the affected arm, do both sides because it's always good to get a comparison, but you're going to take the arm up. Now as you take the arm up, you're going to be using the differentiation between a neck movement and also between a wrist movement. Now whenever I'm bringing the arm up, I'm taking it up and I want to go into wrist extension. So as you take that arm up and you take the wrist into extension, does it give you any symptoms, a tightness? Does it give you any sort of tingling, pins, needles, anything that may be familiar to you? The other movement is whenever you take the arm up, you can move. For example, you're going to move the head in a side bending away from the arm that you've taken into position to see if that highlights any symptoms for you. When you're doing these, again, you don't want to force them, go slowly into the movement, but it's one way of checking just to see if it's recreating your symptoms. That's one test that's put across with the Noigroup. Another test which I have learned through other trainings is to take your hand out to the side. And when we take the arm slowly out to the side, it is going to tension the nerve and it's trying to take the arm out roughly level with the shoulder, and you are already starting to come out with the wrist in full extension. So it's whatever that is possible to notice whether it creates again any symptoms coming down the arm or into the hand. You might feel, oh, it's just a stretch, but whenever you try the other side and feel if there's any difference, especially if you know you're only getting symptoms, say one side to the other. But when you take it away, that idea of trying to differentiate between certain structures, if we add in the side movement of the head, ear to shoulder, not rotation, but when we bring that movement in, does it increase the sensation or does it not make any difference? So it's good to know, because sometimes then whenever we add in a particular movement, it just lets us know, is the affected area more on these tissues where the immediate pull is going to happen? For example, if you get it either towards the forearm and the wrist, or is it maybe more towards the neck? So some of the movements that we do may involve movements in those particular areas to try to get the nerve to slide or to floss. So hopefully this test has been useful. Remember, always do it on both sides, do it slow and progressive and don't force it. That's not necessarily an end position. If you get to here, or if you get to here and you just start to move or just start to move the head and you get symptoms, then you know it's already creating them. You don't need to force it through. So it's important just to get whatever information that you can from it without making anything worse. So I'm hoping that this test will give you some information. But again, if it comes up as a positive result on it, I would definitely recommend you go and see a medical professional just to get checked out, just to see if there's maybe anything linked to that. But if you're giving the go towards the test, I'm going to provide you with some videos of some self-strategies that you can use to try to alleviate some of those symptoms that you maybe get. So I hope you've enjoyed this video. Leave a like, leave a comment and subscribe, and yeah, hopefully we'll see you again.